Investment and commercialization in longevity biotech are entering a phase of dramatic acceleration, driven by converging forces of scientific validation, demographic demand, and economic opportunity. What was once a fringe corner of biotech has now become a magnet for venture capital, pharmaceutical giants, and public market speculation. As the global population ages and the scientific community continues to reveal aging as a modifiable process rather than an immutable fate, the longevity sector is being redefined, not as an aspirational fantasy, but as one of the most promising frontiers of 21st century healthcare innovation. The financial forecasts are already striking. Analysts project that the anti-aging therapeutics market, currently estimated at around $4.5 billion, will nearly double by 2034, reaching nearly $9 billion. But these numbers may still be conservative. As therapies like senolytics, telomerase activators, NAD+ precursors, and gene editing tools begin to show efficacy in human trials, and if just a few of these move toward regulatory approval, the economic landscape could shift at exponential speed. Investors are increasingly viewing longevity not as a niche within biotech, but as an emerging vertical comparable to oncology or immunotherapy in both scale and societal impact. Venture capital, long the engine of disruption, is surging into this space. Specialized funds like Longevity Tech Fund, Apollo Health Ventures, and Cambrian Biopharma are deploying capital across startups focused on aging hallmarks, cellular senescence, mitochondrial dysfunction, epigenetic drift, and immune decline. At the same time, mainstream VC firms and sovereign wealth funds are getting involved, recognizing that the company's pioneering healthy lifespan extension will shape not only medicine but also labor markets, retirement models, and consumption patterns for decades. From Silicon Valley to Singapore, longevity has become a hotbed of entrepreneurial ambition and capital deployment. This investment wave is being matched by growing interest from big pharma, which increasingly sees longevity platforms as a way to diversify beyond traditional indications. The pharmaceutical industry faces an innovation bottleneck in areas like cardiovascular and neurodegenerative disease, markets that are tightly regulated, crowded, and often slow-moving. Longevity biotech offers an alternative path: upstream interventions that target aging mechanisms before diseases fully emerge. Senolytic drug combinations, for example, could have applications across multiple conditions: osteoporosis, lung fibrosis, cognitive decline, creating attractive pipeline assets. As initial data matures, we can expect more licensing deals, strategic acquisitions, and co-development partnerships between pharma giants and longevity startups. The influx of capital is doing more than accelerating clinical trials. It is also catalyzing the creation of entirely new markets. Startups are emerging not just around drugs, but also diagnostics such as biological age clocks, AI platforms for longevity compound discovery, personalized supplement regimens based on biomarkers, and even digital twins for aging simulations. As the ecosystem grows, investors are supporting a full-stack approach to aging intervention, one that includes monitoring, prediction, prevention, and reversal. This diversified strategy reduces risk while expanding commercial reach. For consumers, this investment boom will translate into greater access, choice, and visibility. Already, wellness companies are racing to incorporate longevity into branding, offering everything from age-slowing skincare to microbiome rebalancers. While many of these early offerings are unproven or oversold, the line between cosmetic longevity and therapeutic longevity will blur as evidence-based interventions become more available. Expect to see wearable integrated aging dashboards, subscription anti-aging treatment plans, and clinic networks offering bundled cellular therapies and diagnostics. Some companies will overpromise, but others will deliver real value, creating a competitive market where consumers drive demand and clinical validation dictates staying power. Importantly, the commercialization of longevity will have wide-reaching macroeconomic effects. As the sector matures, it will attract institutional investors, pension funds, endowments, even ESG portfolios, who recognize that extending health span has benefits not just for individuals, but for entire societies. Governments, too, may begin to support domestic longevity sectors as part of economic strategy, seeking to become global hubs of biogerontology innovation. Policy frameworks will evolve in tandem to support longevity-related IP protections, fast-track approvals, and ethical oversight. Yet with all this momentum, caution and regulation will remain essential. The challenge will be separating legitimate science-backed innovation from hype-driven opportunism. As more money pours in, so does the risk of Theranos-style implosions, ventures that promise too much, too soon. For the sector to mature sustainably, clear evidence thresholds, data transparency, and ethical clinical design must be upheld. Regulatory bodies like the FDA and EMA will likely create new pathways specific to aging-modifying drugs, just as they did for gene therapy and orphan diseases. These pathways will balance patient access with scientific rigor. Overall, the surge in longevity investment is not a passing trend. It is a structural realignment of healthcare, venture capital, and consumer priorities around the new understanding that aging itself can be targeted, delayed, and perhaps partially reversed. This realization marks a turning point. Biotech companies that just a decade ago were dismissed as speculative or fringe are now attracting blue-chip funding, top scientific talent, and serious public interest. As commercialization scales, so too will public awareness, clinical adoption, and cultural attitudes toward aging itself. The future of longevity is no longer a question of if, but how fast.